Welcome, and thank you so much for joining us virtually for a news conference. My name is Kelly Chandler. I am the Public Health Division Manager for Itasca County. I am joined today by Jean McDonald, President and CEO of Grand Itasca Clinic and Hospital, Monique Fox, Administrator from Essentia Deer River Hospital Clinics and Skilled Nursing Facility. Monique may need to step away, and so if that happens, I will read her press release. Aaron Saudi, CEO from Big Fork Valley, and Dr. Dan Suler, Family Medicine Physician and Vice President of Medical Affairs, Grand Itasca Clinic and Hospital. We will provide an update on COVID-19 in Itasca County and how our healthcare facilities are preparing and responding. We are joined by our local and regional news media. After our speakers present to the media, please submit questions via chat. We would like you to preface your question with your name and the media organization that you represent. Our panel will respond to the questions that pertain to their organization. Itasca County Public Health received confirmation from the Minnesota Department of Health on Sunday, March 29th, that there is a positive COVID-19 case of an Itasca County resident. The person is in their 60s. We are unable to offer additional information on the confirmed case at this time. We have not received requests to provide essential services for this person. The Minnesota Department of Health will conduct contact investigations and make recommendations to those individuals based on their interviews. Itasca County has been working closely with key community stakeholders to prepare and respond to COVID-19. Itasca County Public Health has implemented a hotline at 218-327-6784 for community members to call if you have questions or concerns related to COVID-19. This information is also available on the Itasca County Public Health website. The Minnesota Department of Health also has a hotline at 651-201-3920. I will now introduce Jean McDonald, the CEO from Grand Itasca Clinic and Hospital.
Thanks, Kelly. I'm Jean McDonald, President and CEO at Grand Itasca in Grand Rapids. And we continue to plan and prepare our staff and our facilities for COVID-19 patients. We've been having regular touch points with our neighbors in healthcare from Big Fork Valley, Essentia Health, Lakewood Surgery, Meds One, as well as Itasca County Public Health, just to share information, talk to each other about how we can work together to make sure countywide that we're prepared if we have an influx of patients. We've been working with local nursing homes to look at isolating some of their available space to accommodate additional COVID-19 patients should that be necessary. Here at Grand Itasca, in addition to limiting the number of people that are coming into our facilities by canceling elective surgeries, non-essential outpatient appointments, and restricting visitors, we're making some other modifications to our physical space. We're working to convert hospital rooms to intensive care unit rooms to expand our capacity to care for those critically ill patients. And as part of the mHealth Fairview system, we will have the option to transfer COVID-19 patients to Bethesda Hospital in St. Paul, which is dedicated to COVID-19 patients, if our regional hospitals fill up. We've also increased our capacity of negative airflow rooms from 3 rooms to 13 rooms. We've split our clinic to provide any essential clinic visits to patients in either a COVID symptomatic or a non-COVID symptomatic waiting room and exam room. We've also created a COVID symptomatic hospital wing on our med-surg unit. And all of these efforts are to mitigate any potential spread of the virus to others. We've been cross-training providers, nurses, and other staff to be able to care for patients wherever we have the highest need. We continue to be overwhelmed by the generosity and the support of our community, and we're so thankful for the partnership of our healthcare colleagues in the county, those on the call today and others. The notes of encouragement and meaningful donations just remind us why we're doing this work and why it's so important. As we plan for a potential surge of patients, we will continue to collaborate with our local partners, take care of our staff, and provide the best care for the community. Thank you.
Thank you, Jean. And we will turn it over to Monique Fox and Dr. Thomas Howard from Essentia Health.
Thank you. Sorry, as we zoom along, and thank you very much for the opportunity to join the group that we've been collaborating with throughout the last several weeks. Monique Fox, the administrator, operations administrator here at Essentia Deer River, along with Dr. Howard. Like our partners here, today we realize that this is scary and unprecedented times, and at Essentia Health Deer River, our highest priority is the health and well-being of our patients and staff. And because of that, we've taken several steps to mitigate the risk of this virus, and those steps include visitor restrictions, abiding by Governor Walz's directive to halt elective procedures and routine appointments, and reducing access points to our facilities. At these reduced access points, we have implemented vital signs and other screening questions to make sure that we actually appropriately mask patients and visitors as they were coming through, and now we are completely restricted to visitors. Additionally, we are continuing to assess the situation and reevaluating our plans accordingly. As we've all seen, this pandemic has created a situation that changes rapidly. And as a result, communication is crucial. We are communicating through our incident command systems through East Operations and continue to drive communication and collaboration. We're collaborating with our regional partners to share resources and ensure a coordinated response in anticipation of the COVID-19 surge. Similarly, we are able to lean on our colleagues across the Essentia system, leveraging their talents and resources to enhance our responses. Consequently, we feel well positioned to care for a significant number of patients beyond our normal capacity. And we too have continued to redesign where we can to improve the number of negative airflow rooms, as well as redeploy staff and re-educate staff. I'll turn it over to Dr. Howard to continue with our update. Thank you.
Yes, I'm the Chief Medical Officer at Essentia Health Deer River. You hear a lot in the news about shortage of PPE, and I want to reassure that we feel we have adequate supplies of PPE in our facility with their system, and we're working on ways to best utilize that and to conserve that ahead of time. We've done a lot of planning for surge planning, as we mentioned. This is driven by predictive modeling and working with our partners within the state, working with Minnesota Department of Health, with the governor's office, and with the 9 other healthcare systems within Minnesota. We made a tremendous efforts into expanding the patient access to our clinics for e-visits and virtual visits. We have patients that are concerned about COVID symptoms, but there are other healthcare needs. And they feel anxious sometimes to be able to get a hold of us, but we have expanded those services. If you want to get started with that and one of our patients, please, if you aren't already set up, you can visit essentiahealth.org to set up that program. And we have a hotline, a COVID-19 hotline, and it's 833-494-0836.
Thank you.
Thank you, Monique and Dr. Howard. Now we will introduce Aaron Saudi, the CEO of Big Fork Valley.
Thanks, Kelly. Yes, I'm Aaron Saudi. I'm the CEO of Big Fork Valley. In collaboration with other healthcare entities present today, along with many other partnerships and associations, we have dedicated our time over the last few weeks solely to preparing for the arrival of COVID-19 in our county and communities. We spent countless hours within our incident command center and throughout our organization to adequately respond and provide the essential care to our patients in regard to COVID-19. We are prepared to accommodate patients that present to our hospital with this disease and continue to live by our mission to serve our community with skill and compassion. We've implemented many of the same changes to our operations as the other healthcare entities, including limited entrances, screening visitors, implementing curbside pharmacy pickup, canceling elective surgeries, and rescheduling outpatient appointments. We are preparing our surgical area to be used as an isolation ward to ensure we are prepared for any surge of patients requiring care. We're working closely with Scenic Rivers Health Services to dedicate separate clinical space within our facility for screening patients with COVID-19 symptoms. As an independent rural hospital, we are so grateful for the collaboration that we've experienced from Itasca County Public Health and the healthcare systems in our region. Together, we're certain that we're doing all that we can to best serve our communities through these uncertain times. We want to reiterate the importance of abiding by the stay-at-home executive order, ask you to continue practicing social distancing, and as always, take necessary precautions to maintain your health. We will continue to follow the direction from the Centers of Disease Control and the Minnesota Department of Health for their guidance as we navigate this pandemic. And I want to assure you that we will always show up for our patients and community as they have done for us. So we appreciate your continued support.
Thank you, Aaron. And now we will introduce Dr. Dan Suler from Grand Itasca Clinic and Hospital.
Thanks, Kelly. I'm Dan Suler, family medicine physician and vice president of medical affairs at Grand Itasca Clinic and Hospital in Grand Rapids. With the first confirmed case of COVID-19 in Itasca County, we expect that some of you are feeling more anxious and concerned. But since testing has been so limited in our state, we've assumed that there have been cases of COVID-19 in our area for a while now. We need to continue to understand that there are likely more cases in our area than what we are able to confirm with testing. This positive case is a potent reminder, however, that we are not invisible here in Itasca County, and we all need to take seriously our role in slowing the spread of COVID-19. The Centers for Disease Control recommends everyday preventative actions to prevent the spread of respiratory viruses, such as washing your hands with soap and water, avoid touching your face, covering your cough or sneeze with a tissue, and cleaning frequently touched surfaces often. All Minnesotans have been encouraged to practice social distancing in order to stay home by Governor Walz. By making healthy choices and adhering to these requests, we can help flatten the curve and allow our hospitals time to care for patients and help reduce a potential surge that could overwhelm our healthcare system. If you have mild symptoms of fever, cough, or shortness of breath, please stay home and self-quarantine. If your symptoms get worse, please contact your health care provider for further guidance, which may include staying home and self-monitoring, a virtual visit, or an in-person visit. Our organizations are committed to caring for our communities. Please help us help you by taking care of yourselves. Enjoy some fresh air and bring awareness to what's important in your life. We're in this together, and we'll get through this together. Thank you.
Thank you, Dr. Suler. And now we will turn it over to question and answer. And again, I ask members of the media to please introduce your name, the organization you are working for and with, and the question. And the first is from Beth from ICTV. What type of transmission was the COVID-19 case? Was it community spread or travel? That information is not available to us at this time from the Minnesota Department of Health. And another question from Beth. If the person was tested, under which category of testing did they fall? Persons are concerned that they cannot get tested if they're not in the hospital or a healthcare worker or in a congregate setting. I invite our healthcare partners to respond to that.
Yeah, so I can answer that. So this particular patient was hospitalized at our facility. Patients that are sick enough to be hospitalized are currently eligible for testing through the Minnesota Department of Health. So he was tested upon admission. He has since been transferred to an external facility, and we got our test result yesterday.
At this time, I am not seeing other questions, but we will wait for a few more moments. Okay, Kathy from KOZ Rye Radio. Many local residents are making their own masks from cotton fabric. Can these be used, and in what situations? And what are the possibilities of running out of N95 masks? I again invite our healthcare partners to respond initially.
This is Monique, currently from Essentia Health. We are in a good position with our PPE, and we are practicing PPE conservation and working every day to revise any guidelines that come out from MDH as well. So, but we are very well set now. Howard, do you have anything?
As far as the homemade thing, I think it's good for if in the community. It will most likely make droplets that are coughed smaller. They won't spread as far. We're not utilizing them in a healthcare setting. But if they want to use them and hand them out to their friends, if they have no other options, I think that's very reasonable.
This is Jean from Grand Itasca, and I agree with Dr. Howard and Monique. We too are practicing conservation of all of our supplies. We've had a hard time getting what we need, and we do have supplies of masks at this point, but we don't have enough to have everybody masked all the time, which can be a hard message, but we are practicing masking based on the CDC and University of Minnesota guidelines, the Department of Health, and we're doing what we can to conserve and continue to keep our staff and patients safe.
I would add for the PPE that our Itasca County Emergency Manager is tracking PPE requests locally and regionally. And he has a system in place for organizations that are requesting PPE, and also some protocols in place that we can request PPE. So that is an ongoing concern, and we are addressing that within Itasca County. Sally Sedgwick from Scenic Range, how long was the test protocol used and when was the test actually taken? Grand Itasca.
Yeah, so, upon admission, if any patients screen positive with symptoms, which include fever, shortness of breath, or cough, we're testing them, the moment they enter our hospital floor. So this particular patient was tested, and, while we wait for the test results to come back, which can take, 2 to 3 days, we are treating all of those suspected patients as if they're positive, just because we just don't know, and it does take some time to get that test result back. So in particular with this particular patient, like all of our patients, if you screen positive for these symptoms and you are admitted, you're getting screened upon admission.
Thank you. This next question from Britta at the Herald Review, all 3 facilities can answer. How many tests are being done at Itasca County facilities on a daily or weekly basis?
I can start. We are tracking them daily. I would say since the COVID-19 crisis started, we've done approximately 30 tests.
Essentia Health, did you want to respond next?
We are not able to share that information at this time.
Great. Erin from Big Fork Valley.
Yeah, I can comment that the last time I inquired, we had only sent out 3. So that's the amount that we've done.
Thank you. Bradley from Lakeland Public Television, are non-essential surgery recovery floors being prepared for potential COVID-19 patients? Grand Itasca, would you like to start, or?
Sure. Yes, our search plans include using our day surgery rooms. Some unused ICU rooms historically are being converted into usable rooms. And we're also using some of our endoscopy. We've converted those endoscopy suites into negative airflow rooms for our COVID-19 patients.
Essentia?
Yeah, in Essentia, we are repurposing several different rooms within our hospital to be negative airflow rooms or to be utilized for COVID type symptoms, including the outpatient surgery department, etc.
Right, we want to be able to have cohorts of patients under investigation, as well as our active COVID patients that may remain here prior to transfer to the.
Thank you. And Erin from Big Fork Valley.
Yep, that's our plan as well, is to utilize our surgical space as a isolation ward. We would have at least an additional 7 beds in that space.
All right, Nishai, it was said the virus was assumed to be in the area for quite some time. How long has the county had an idea of potential cases? That is a great question, and we have assumed for a few weeks that there was COVID-19 in the area. However, we have not received confirmation until yesterday. And Nishai, are there plans to set up testing sites? At this time, the only testing is at the healthcare facilities. I will let each healthcare facility respond if there are alternate plans for testing. Grand Itasca?
Yeah, thank you. We do have testing. We're ready to test in our clinic if the restrictions for testing lighten up. We did implement a curbside testing facility just in front of Grand Itasca's clinic, so patients didn't have to come into the building for testing unless they were sick enough to be in the hospital. And once the restrictions are lifted, we will open that back up again. Otherwise, our facility is testing per the protocols and restrictions at this time.
And Essentia?
This is Monique. We are also testing for the protocols, but we do have 2 testing sites set up, one in Duluth and one in Virginia at this time. We do have the ability, if the testing restrictions are lifted, to do curbside testing here for people that may need that.
And Big Fork, did you have plans
Sure.
for testing sites?
Yeah, we're following the guidelines as well. We have discussed a separate space within our facility where clinical patients with symptoms can be taken to, so we don't have to bring them within the clinic portion. And then we are also evaluating using our decon room that is before the entrance of our ER, setting that space up for initial screenings of people that present with those symptoms.
Thank you. And Renee has asked, any advice for snowbirds? Do one of our medical providers want to respond to that for persons traveling who have traveled away from our area and are returning?
Well, for ones that are still there, what do they mean by, or ones that are already here?
It could be either or, either people returning or people already here.
Well, if someone is, if a patient of mine is in another place and they haven't come here yet, there's a risk of traveling from there to here. And COVID is everywhere. So if they feel that they have a system, but they can stay where they are and they feel safe there, I would advise them to stay there if they could. Because I don't think that we can say we're any better off here than a lot of other places. And certainly the future is uncertain. So there is a risk to traveling. So that's what I would advise my patients who aren't here yet.
You know, I would agree with Dr. Howard. For those that have recently returned, you know, especially a lot of our southern states are hotbeds right now. And so, you know, I would ask them to self-quarantine for the full 14 days, just in case they're asymptomatic. They may feel great, but they could easily spread to some other folks in our community. So if they've recently returned, I would urge them to stay at home and self-quarantine.
From Nishai, questions about information on the positive COVID-19 case. The person is in their 60s, and that is all the information we have at this time. Yeah, we'll give it a couple more minutes to see if we have more questions come in. And I am not, oh, we have one more. Britta from the Herald, past this first case, how will you be notifying us of cases? So we received a phone call from the Minnesota Department of Health last evening, and going forward, we will be receiving emails with further positive cases in Itasca County, and we will issue press releases for the next few positives. If it becomes a point where we're have an overabundance of cases, we can update that information on our website, or the actual Minnesota Department of Health website is updated at 11 a.m. every day. And if you scroll over the virtual map over Itasca County, it will update with the amount of positive cases that we have. Our website does link to the Minnesota Department of Health website for the situational update, and they will always have the information prior to us. So that will always be the resource to go to first. Right. I am not seeing further questions at this time, and so we will end this press conference. Thank you so much for joining us and for joining us virtually. Have a good day.
Thank you.